Well, the problem is that we've been trying to get OBGYNs recruited into Kamloops to complement the 7 OBGYNs we have for several years now, and they haven't been able to fill those positions. They've used temporary locums. One of those locums is no longer available. Even getting locums has been very hard. So the minister is correct. These OBGYNs are fulfilling that they have to be there for another 90 days with working at the hospital. But given that it's taken several years and haven't been able to find any permanent fixes, to think that the government can just turn their backs on 7 OBGYNs and say, well, we'll accept your resignation. See you later. We're done negotiating. And the minister can say they're still negotiating. But the simple fact is, according to the doctors, on the afternoon of October 10th, the Friday of the long weekend, they were informed by Interior Health that the government and Interior Health were done negotiating. They accept their resignations, and it's time that they move on, and they'll make other arrangements. So nothing is adding up here from the government and Interior Health side, but the doctors have been pretty consistent on what they've said has been unfolding through this whole event.
One of the things that I find a little confusing, and you just touched on it there, is the government continually says, we're still talking to them, we're still negotiating, we're hoping we can work this out, we understand that there are concerns. But the doctors themselves are saying, well, no, they said they've tried to put solutions on the table that haven't worked. And they put out a statement earlier this week saying it's extreme burnout. It's an unsafe situation in this hospital, and that they've tried to fix it and the government's not listening to them. So are there negotiations underway or not?
According to the doctors, there's not. And,
okay.
and this is the problem. It doesn't feel like the government is truly taking this seriously. I've said all along, like this has been an issue according to the OBGYNs. They've been trying to engage with the government for 8 years. We know of very public problems with obstetrics and maternity in Kamloops for at least 3.5 years now, be it from nursing shortages that created problems on the floor, to the TRFO, the obstetrics clinic, and funding issues and staffing issues that go back 3.5 years. The midwife clinics struggling to find proper funding from Interior Health as well. All of these mixed together has created this situation. And if anyone thinks that 7 OBGYNs, most of which have been there for a decade or longer in Kamloops, are taking this step, out of greed or out of malice or anything like that, or not having care for their patients, they'd be incredibly mistaken. They're doing this because they're trying to shine a light on it, and they essentially said to the government, we need you to actually seriously take our concerns, or we'll be faced with no choice but to resign. And the government's response was, go ahead and resign, we're done negotiating. That to me is reprehensible to the nth degree. This is about women's health. It's not just about obstetrics. It's about the gynecological surgical capacity as well. We're talking about Kamloops, which is the second or third busiest trauma center in the province. Other surgeons get pulled away, understandably, for other traumas. We need to have proper GYN services in that hospital at the same time.
And Kamloops, this is not exclusive to Kamloops. I mean, we've seen these type of pressures in other cities and other hospitals when it comes to women's health services and maternity doctors, right?
Absolutely. And over the summer, we had Prince George go through maternity issues. The recommendation from Northern Health was go to Kamloops. 2 weeks later, we had problems in Kamloops with maternity. So this was even flaring up over the summer, where they couldn't find locums to cover off some shifts in the summer, with doctors already facing some burnout in the summertime for patient safety reasons. So this is very serious. It's very systemic. And it needs to be addressed. And simply saying, well, we are negotiating, when the doctors very clearly are saying that they're not. I will side and believe the doctors every day of the week over the constant changing story from the minister and Interior Health.
Well, let's have another listen to the minister here on this point. And you were really grilling the minister in the legislature on this week. So this is Health Minister Josie Osborne, again, continuing to insist that the government's trying to work this out with these doctors. Let's listen.
Interior Health has made it very clear that they are willing to sit down and talk with, and they are talking with and have been for months, as the member indicates, on this. Interior Health has also heard from at least a dozen other OBGYNs who are interested in prospective employment.
Oh, okay. So she's saying there are other maternity doctors who say, okay, we'll take a job in Kamloops. Is that what's going on there?
Well, again, we've been trying to fill a couple of positions for several years. My understanding is all 12 of those actually tried to fill those couple of positions and were rejected. They're not credentialed within Canada. It would take years.
These are foreign-trained
doctors where, for various reasons, they're not credentialed in Canada. The process with OBGYNs, as my understanding, is that it would take 2 years of shadowing with another OBGYN, which doesn't exist anymore in Counts in a few months, to bring them up to speed and to bring them on. And so to think that the 12 that would previously have been rejected from that exact hospital are now going to be the savior of that hospital in 2 months' time is ridiculous. And so it doesn't mean they can't be brought up to speed over time, but these are things that do take a lot of time. What the government needs to do is intervene. Obviously, Interior Health has not been able to come to an agreement. The one thing the minister is correct about, Interior Health and the OBGYNs have been in discussions for months. It was Interior Health on October 10th that got this ball really cascading by saying we're done negotiating. The Interior Minister of Health is done negotiating. We accept your resignations. And so they've essentially fired these OBGYNs.
Well, they say that, but we just listened to 2 clips of the minister saying we're still talking.
Well,
so what do you mean they fired them?
Well, because they told them on October 10th. So the letter that everyone knows about is the October 11th, dated October 11th from the doctors. That was drafted up the day after they were told by Interior Health that the Ministry of Health and Interior Health were done negotiating. We accept your resignations.
Okay.
And so that is essentially a firing. If the minister wants to clear this up, I challenged her to provide the Interior Health email from 4:30 in the afternoon on October 10th. The doctors, for legal reasons, won't provide the government-provided email. So the government could provide that.
How do you know about the email?
The doctors have told me about it.
Okay.
And so
but the government won't release it?
No. And that's what I'm asking them to do. So release the Interior Health email that went out at 4:30 in the afternoon on a Friday of a long weekend, telling 7 OBGYNs, thanks so much, we're done talking, and we'll figure out other arrangements.
Let's talk a little bit about the concerns that these doctors are expressing now. They've said there's been this heavy workload. They're suffering from extreme burnout. I guess they're looking for some help, some assistance, or short-staffed. This is Dr. Lynn Murphy-Callbeck, president of the Society of Obstetrics and Gynecologists of Canada, commenting on the case. Let's listen.
You're referring to a number of things. One of the issues, I think, is lack of staffing, so lack of support, nursing, other healthcare providers that do with obstetrics. When you look at when you're short on obstetricians or you're short on pediatricians, whatever that may be, women often get delayed in induction or delivering, being prepared for delivery when they're supposed to.
Yeah, I mean, this is serious stuff. If you've got an expectant mom who's in a high-risk pregnancy or something, right?
Absolutely.
And they're short staffed. I mean, this is really, really concerning and serious stuff. Now, what she described there sounds like it's just short of staff. Like they don't have enough nurses or enough help or assistance or something? Is that?
Well, what she was just describing is exactly what I started off describing in terms of the shortages and the pressures we've been feeling with maternity care for years now in Counts, be it nursing at certain points on the floor, be it the obstetrics clinic, the TRFO, be it the midwife clinics, be it obstetrics itself in terms of the OBGYNs and the numbers and the inability to get locums at certain times and things of that adds extra pressures. So all of those put together has created this final moment in time where the OBGYNs have said, look, we were under the understanding just before the last election that we actually had an agreement in place, and then that disappeared a year ago.
What about money? Are they looking for a raise too?
There's absolutely that does come into play, and they've made no secret about that.
How much more money are they asking for?
It's a little unclear. It's around how the 24-hour shift that they work on call unfolds in terms of how they work that shift compared to what an OBGYN at a Kelowna General or a Vancouver General would see in terms of patients and numbers and remuneration and the types of procedures they're doing. So that gets a little more complicated, admittedly, but it really comes down to this. If we're going to continue trying to have this one-size-fits-all and treat Kamloops, Nanaimo, Prince George as if they're Vancouver, that is not the case with specialists. We're having issues with cardiac specialists. We're having issues with urology. We're having issues with OBGYNs. There's an issue here with specialists that the government needs to step up to the plate and say one size fits all does not work.
These are highly paid professionals, and I understand that. These are specialists, like you mentioned, but, it costs a fortune to bring in these locums, too.
It
Right.
absolutely does.
Wasn't there a report the other day that these locums that they want to bring in to replace these doctors are like $7,000 a day or something
Well,
like
yeah,
that?
and this is the problem with Interior Health and the ministry. We had a massive shortage of nursing for a while, and their solution was to bring in agency nurses. My understanding is they're still relying heavily on those, where we would have saw wards of other specialties and other areas of the hospital feeling immense staffing pressures as well. This has been systemic for years within Kamloops. The Band-Aids are no longer working. The stress, the patient safety, first and foremost, is under
Yeah.
siege,
Yeah.
and the government needs to be forthright and open, and not just simply deflect away and say,
Okay.
"Well, we are hoping to still talk with them," when
Yeah.
in fact they're sending emails saying the exact opposite.
All right, welcome back. Peter Millibar is my guest, the Conservative MLA in Kamloops, talking about the crisis in women's health, the maternity doctors that have all issued notice that they're going to quit at Royal Inland Hospital. Malcolm in North Vancouver on the open line. Hi, Malcolm, go ahead.
I've been 25 years in medical technology, mostly in Ontario, and one of my best clients was up in the OMA, and he said the biggest problem with getting new doctors in, especially the foreign trained doctors, is the medical associations, is the government, because they don't want, and it's the government that listens to the nurses association, the doctors association, or whatever the association. No, we don't want to water it down. Well, look what's happened. You don't water it down. Now we're in the crisis mode. Get these people who are foreign trained, fast track them. Pay for their damn schooling if you have to, but get them in here. This is ridiculous because, as Pat told me one time, there's 3 standards that they go by. There's a North American standard, a world standard, and a European standard. Well, it's ridiculous. I got a friend of mine's son who's down in Australia getting training. He'll have to go through 2 years of retraining just to get up to the North American standard. It's all the same thing. So get off your asses, people, and get rid of the associations.
Okay, thank
And
you,
that's
Malcolm.
my comment for Wednesday.
Thank you, Malcolm, for the call. I mean, I remember vividly talking to a doctor who was trained at a big university in the United States and was having trouble getting up here. I mean, not like they're coming from some developing country or something. They're a big university in the USA, and they were having trouble getting accreditation here. But the government says, now this is another one where the government says, we're working on this. We are streamlining it. We are fast-tracking it, right? Your thoughts?
Yeah, it's no doubt that there is an issue, and there has to be a better way to fast track those that can truly just be fast tracked, either by accrediting ahead of time what universities they actually went to, and say, okay, if you went to the University of Ireland, we consider that a same level of education
Equivalent.
as U of A, right? You
Yeah.
can credit potentially institution by institution around the world versus accrediting a country broadly, because there could be wide range even within certain countries. But again, these are the issues that we've been facing. These are issues that these doctors have been bringing forward for quite some time, and they've been ignored.
Squeeze in one more call. Nicole in the Tri-Cities. Nicole, you got 30 seconds here, okay? Go ahead.
So I had a baby 6 months ago at Royal Columbian Hospital, so I can totally understand where these doctors are coming from. I was sent home from induction because they didn't have enough nurses at Royal Columbian.
Oh, okay, Nicole.
Imagine how short-staffed they are.
Thank you, Nicole. She's breaking up on the phone, but I could understand that she said that, she went through a pregnancy where it sounds like she had some troubles too. So
yeah, exactly.
You have 30 seconds here.
Yeah, so it's really about listening to the doctors, listening to the nurses, listening to the midwives, in this particular case within Kamloops, and figuring out what they are all saying, because they are trying to work as a cohesive team. And each time that they feel understaffed or underfunded, it creates more pressure on the other side of the equation, and it's the government missing in all of this.